Good morning, everybody. To 8 p.m. Yesterday, there were more than 105,000 tests throughout New South Wales. Again, a good high number for us to be able to capture all the cases in the community. Unfortunately, we did have 233 cases of community transmission in the last 24 hours. At least 47 of those at this stage were infectious in the community for that time, and that's the number we're desperate to see reduce. Can we urge people to please heed the health messages? Don't leave home unless you absolutely have to, and please stick to the rules to make sure we reduce the case numbers moving forward. There are three key matters that Dr. Chant and I would like to convey this morning. Firstly, concerningly, there were very high rates of virus detected in the sewerage in the Hunter, Newcastle area. Dr. Chant will call out the suburbs where we really need people to come forward and get tested. The sewerage detected high viral load, which suggests there could be undetected cases up around the Newcastle area. So we're really keen to have people come forward to get tested. There will be a list of the drive-through testing places that people can go to. So please look that up. And if Dr. Chant calls out your suburb, we're really keen for people to come forward and get tested. If you have the minimal of symptoms, or if you're concerned, please come forward and get tested. Secondly, New South Wales Health is concerned about how quickly the virus is spreading in apartment complexes. Please take note not to congregate in communal areas, not to stay or stand around in areas outside of your actual home, not to share lifts with other people, not to use any facilities that may have been in touch with other people or any other human contacts. So we're really calling out to say that the Delta strain is very contagious as it is, but clearly in apartment complexes it adds an extra layer of complexity, an extra layer of caution we're asking everybody to undertake. And thirdly, very sadly, a male in his 20s passed away at home with COVID from southwestern Sydney overnight. Obviously, our deepest condolences to his family and loved ones, but it demonstrates again how this disease is lethal, how it affects people of all ages. Unfortunately, the gentleman wasn't vaccinated, hadn't had any dose of the vaccine, and as we understand it, the death happened quite suddenly, but I'll ask Dr. Chant to provide any further details on that. It's so important for the community to come forward and get vaccinated. Overnight, New South Wales hit that 4 million jab target, which is great. And obviously, I've set ourselves a goal of getting to 6 million jabs by the end of August. It's really important for us to have the tools available to us so that we can consider what life looks like beyond August 28. And it's really, really important for people to come forward and get vaccinated. As we've seen, people who are vaccinated are staying out of hospital, are staying out of ICU, are helping reduce the spread because they're less contagious. We can't stress how important it is for people to come forward and get vaccinated, and especially for our communities, and we're doing a lot of work on the ground in those 8 local government areas to make sure people come forward and get vaccinated. And the vaccine not only protects, again, in protecting your life and the life of those around you, but also reduces the likelihood of you spreading on the virus to others. Again, I want to stress, every time you leave your house, you have to assume you have the virus or anybody you come into contact with has the virus. And can I just stress to everybody that if all of us do the right thing, if all of us follow the health rules, we'll see those case numbers come down, but at this stage they're not. And we want to see that turn around as soon as possible. Thank you.
Thank you, Premier. So there were 233 locally acquired cases of COVID in the 24 hours to 8 p.m. last night, and 1 overseas case. In terms of the, tragically, there were 2 deaths. A woman in her 80s from the Inner West died at Royal Prince Alfred Hospital yesterday, and she tested positive for COVID on the July 27th and was being cared for in the Royal Prince Alfred Hospital since then, and she was not vaccinated. And there was also a man in his 20s from southwestern Sydney. He died at his home yesterday, and he was confirmed case of COVID and was isolating at home. He was being cared for by Southwestern Sydney Local Health District during his isolation period, and he'd reached for day 13. He was being followed up daily by nursing staff, and he had suddenly deteriorated. So that death is also being referred to the coroner, as I understand it. I would also like to urge everyone after a COVID test that has symptoms, not the surveillance testing, please go immediately home after you've had a test and do not continue in the community. It really is critical that we don't further transmit the virus. So just as a reminder, you are required to self-isolate if you've had a symptomatic COVID test. Also just wanted to highlight the fact that we are very concerned about the fact that we've had a sewage detection in the Newcastle system. So there's been a detection from the Shortland sewage treatment plant and the Burwood Beach sewage treatment plant, and a lower detection in the Belmont sewage treatment plant. These sewage treatment plants serve in a number of areas, and we'll put those on the website. But a particular call out for all of Newcastle and Lake Macquarie, but particularly Birmingham Gardens, Shortland, Maryland, Fletcher, Minmi, Cameron Park, Mayfield, Stockton and Fern Bay. It is critical that we can get those testing levels up to really understand as soon as possible whether there is any undiagnosed cases there, so that we can make the best public health decisions. In terms of other sewage detections, we have had low levels of detection from the Coffs Harbour sewage treatment plant and the Mudgee sewage treatment plant. Again, we want to see high rates of testing there, again to make sure that there isn't any unrecognised transmission in those communities. I would also like to highlight the fact that we are seeing some cases in apartment buildings, and we have seen transmission with the Delta strain more than we've seen with previous strains in this context. That was why we introduced mask wearing for common areas, and why we're also messaging now to be careful as you move about apartment buildings. Please, in apartment buildings, get tested at the earliest possible time, remain isolated, but also sharing lifts with people, minimise your exposure to any common areas, really go in and out directly of apartment buildings and minimise your interactions with others. We are responding to 9 cases across 7 units in our Campbelltown apartment complex, and we're instituting further testing and control measures in relation to that apartment complex as we understand how transmission occurred. Some of the transmission events clearly occurred between family groups or friends, but we are interviewing a number of cases that were detected overnight through swabbing of that entire premise, and we'll make those decisions after that. Also wanted to just highlight and give a big call out for vaccination. It is really very concerning that so many elderly people are still unprotected. I do look at the data every day to look at how many people are vaccinated across all age groups, and whilst we want everyone to over 18, the ATAGI advice is to strongly consider vaccination in the context of the current outbreak in New South Wales. It is just really tragic when I see that people in their 70s, 80s and 90s are yet to be vaccinated. We know vaccines work, vaccines protect you, even one dose. I urge people to come forward for their second dose promptly and not delay. And also I urge people of all age groups over 18, consistent with the ATAGI advice, to consider vaccination, talk to your immunisation provider. Immunisation access is increasing, particularly in southwestern and western Sydney, and it is important that everyone takes that on board.
Doctor, in regards to the statutory recommendations, we heard last week that there were many people who weren't going to hospital soon enough. Had he been offered hospital treatment in that week?
Yeah. In terms of this gentleman, and I think this is why I understand it's been referred to the coroner, but I'll just need to confirm that with the local health district, that he was being checked daily, and he did complain of feeling a little fatigued, but the deterioration will happen suddenly, as my understanding. So I think that is important that we understand. We are aware that with COVID you can get sudden deaths, and I think that is important to understand, that your health status can deteriorate and you can have sudden deaths with COVID infection, but obviously the correct course of action will occur. Not that I'm aware of.
How had that man contracted the virus? Was it in a workplace setting? Was he a critical worker?
I'm not across that detail, but certainly we also, can I just express my incredible condolences to his family, and it's a tragic time.
Was he living at home alone, or was he with family members?
He was with another person, and you can imagine the trauma for that other person who is now being hospitalised. That person also had COVID, and that person has been hospitalised and offered all care. You can imagine how traumatic such an event was.
Premier, there's a long list of exposure sites that New South Wales Health have released, and they include the Reject Shop Seven Hills, the Edge Supplement Nutrition Parramatta, Dollar World Australia Warwick Farm, Captain Cash Loans Cabramatta, Accounting Dynamics Cabramatta, Bunnings Bellambi, Bunnings Minchinbury, Bunnings Ligplam, Bunnings Kingsgrove. Why aren't some of these businesses shut? Why are people still travelling to work? Can't you go harder with this lockdown, because what you're doing at the moment isn't reducing the numbers?
Obviously, the lockdown rules we have in New South Wales are some of the harshest our nation has seen. And we need people to remember every time they leave the house that they could have the virus, or someone they come into contact can have the virus. Now, the list, for example, of critical workers we have is very small, it's very short. But even then, we're seeing rates of transmission.
Why is the Reject Shop open?
Well, those non-critical retail is not supposed to be open, and if there are historic situations where health has listed a site, it may be a historic situation where people are asked to come forward and get tested, well then so be it.
Last week. Why is Bunnings open? It's not open in Queensland.
Next question.
Why is Bunnings open?
Masks, Premier. There is a loophole that allows people who want an exemption from masks to seek a stacked deck from a JP, not actually go to a doctor. Are you going to close that loophole?
Well, I know that the Police Commissioner and the health authorities had conversations last week, and the health orders were tightened around mask wearing. I'll ask Deputy Commissioner Warboys if there's anything additional on that point.
Good morning. Thank you, Premier. This has been a topic of discussion for some time now. I said right at the very start that every single police officer is an investigator. They will deal with every single circumstance on its merits in terms of the stat deck or whatever else is produced by a person for not wearing a mask. The police officer will take that into account, will then make inquiries and conduct an investigation to see whether an infringement notice should be issued, and that will continue to be the case.
Would it be better to have a medical certificate from a doctor or a nurse at least as proof?
If a person had a medical certificate from a doctor, from their own general practitioner, that would be, unequivocal evidence to a police officer if they could match that to their identity to make no further inquiries. But what we've seen right throughout this pandemic is people want to find a loophole, people want to go outside the public health orders and then try and justify it. What I'm saying is that police officers will investigate that, and they will take action where they think it is necessary and appropriate.
When will the government release the health advice that has driven the decision-making throughout the outbreak? The Public Accountability Committee says it was due at 3 p.m. yesterday but wasn't provided.
Oh, look, I'm not aware of those requests, but please know the New South Wales Government is extremely transparent in conveying our decisions. As soon as we get advice that we need to announce to the community, we do that. And I know there are various committees asking for various things, and I'm sure those processes will occur in due course.
I know that every day we hear about how badly it is going with Delta overseas in other nations, and you've said, we've avoided some of those situations here. But if you look at places like Florida, particularly for young people, the numbers are really out of control. What makes you so confident that it's going to be safe to allow so many unvaccinated Year 12 students to start moving across the city, given that they won't be vaccinated if they don't live in the hotspot areas, and that we have such high case numbers still?
Yeah, can I make the following point about Year 12, and that is our commitment and the outcome remains that every Year 12 student who's a candidate for the HSC we'll make sure they get their qualification. And of course, we announced that from the 16th of August there will be some opportunity for some level of face-to-face, but we'll have more to say about that. There's no doubt that we won't want children or students moving around those 8 local government areas of concern in particular, which is why we're having them vaccinated from the 9th of August, but obviously it takes a few weeks for the vaccine to take effect. So we will provide confirmation of our plans for Year 12 moving forward later this week or early next week, and I want to make that clear that we're not going to support any initiative which is going to worsen the situation or become a health risk, but at the same time I want to assure Year 12 students that they'll be able to sit their exams in October. They'll be able to get their HSC. It might be a bit different to what they anticipated in terms of the journey to get the HSC, and they're the issues we're going through at the moment. The health team and the education team are meeting daily to discuss all those issues and those challenges, but I just want to stress to Year 12 students and their families, as difficult as it is, each and every one of you will be fairly assessed to attain your HSC. There is a requirement for public exams to be sat in October, which obviously is going to take place. So what we need to do between now and then is provide certainty as to what level of face-to-face will exist from the 16th of August.
Possible that not all students will be going back from Year 12, depending on how the case numbers go.
We are health and education have been in constant discussion about what face-to-face might look like in certain areas, and we know that in Greater Sydney there are some, including the Central Coast and Shellharbour and Wollongong, there are some areas which have had very low to no virus cases. There are some other areas, including the 8 local government areas, that have very high numbers of cases. So we're working through those issues to try and provide opportunities as best we can and alternatives as best we can, but we're keen to make sure, especially when it comes to oral exams or those situations where children must have some kind of face-to-face contact, that it's done safely. And of course, every child, every student will have the opportunity to sit for their exams in October. But that's why it's so critical for us to vaccinate the 16 to 18-year-olds in those 8 local government areas of concern. When they do go to sit for their exams, or when they do need to turn up during now and that time for any face-to-face, oral or major works or anything like that, we want them and the community to be protected, and that's why it's so critical. But as Dr. Chant had said a few days ago, that age group is also quite mobile and susceptible to getting the virus and taking it home to their families. So making sure we vaccinate that cohort of Year 12 students will make sure that we reduce the chance of spread of the virus, but also increase the vaccination rates in that critical part of Western Sydney, and hopefully they'll then be able to encourage their families as well to come forward and get vaccinated.
You came out last week and said that Year 12s were going to go back to face-to-face learning just a week ago. So was that a premature policy, and was there not enough consultation done before you made that announcement?
Oh, look, that was definitely our intention, and our intention still is that where that's necessary, that will occur. But exactly how often that occurs and in what context is being determined this week. And so I do want to foreshadow that given where the case numbers are at, especially in those 8 local government areas, and especially as children or students won't be vaccinated until the week of 9th of August, that we need to make sure we adjust our policies according to what's happening, and I want to make that very clear. But I also want to stress the following. Please know that if you are a Year 12 student or a family member of supporting a Year 12 student, all Year 12 students will be getting their HSC. The path to how they get there will be a bit different to what they may have hoped it would be, and also we'll make sure that where face-to-face is required, that will be done safely, and also whether the settings will be different across different parts of Greater Sydney. As we've seen, it's both one silver lining but also a negative, that obviously some parts of Greater Sydney are far more impacted than others, and some parts of Greater Sydney have 0 to no cases. So therefore it's likely that we won't have a uniform policy, but one which reflects what's happening in their communities.
The position on Year 12 has now changed somewhat. Does that pretty much mean that kids, the rest of the children population, won't be going back to school this term?
Oh, look, no, I don't want to make any of those comments until we have further information, and let's take a week at a time. We know what's happening in the month of August. Year 12 is the only outstanding question as to how frequent the face-to-face will be. There will be some level of face-to-face, but obviously the extent of that will be determined by the health advice. We also hear, obviously, all the time, principals and parents would like as much information information as possible. So clearly we know what the virus is doing in some parts of Sydney, but in other areas like the Central Coast and Shell Harbour and Wollongong, we've still seen a very, very low to zero number of cases, but in other parts of Greater Sydney, especially those 8 local government areas, there's obviously a high viral load. So it won't be uniform, can I stress that? There'll be obviously approaches depending on what is experienced in those communities, but it's important for us to prepare for every student to sit the HSC in October to make sure that that's a safe way to proceed, and that's why it's really important for us to vaccinate those HSC students in those 8 local government areas of concern, so there'll be no doubt that they'll be able to sit for their exams, get their qualification and move forward.
Contact tracing, we are seeing huge numbers of locations still coming through. Anecdotally, we've had people in our own office getting a text 5 days after a site was listed from New South Wales Health. Are contact tracers now struggling with the numbers?
Look, I'll get Dr. Chant to comment on that as well, but I understand we've had a boost to the numbers in the last few days with ADF contact tracers coming on board as well. And please know that sometimes those venues are identified or put up when our contact tracers get additional information for people who are positive. So it's really important that when you are contacted, not only should you provide every memory that you have of where you've been, but also make sure you tell our contact tracers everything you know at that first interview. That will reduce the time it takes to get in touch with everybody. But I also know, based on the briefings that I've received, that our contact tracers are using newer techniques, like making sure that everybody in somebody's phone is contacted, that caution is taken. So often health will cast a wider net than what is traditionally necessary to make sure that everybody is captured. And I'll ask Dr. Chan if there's anything further to say.
I think it's reasonable to acknowledge that with the increasing case numbers, it has been challenging. So systems have had to ramp up, and we've had to put in place some incredible surge, and I'd like to thank the Defence Force for their assistance as well as part of that, as well as streamline our systems. So our priority has been getting up those texts, messages, and given that someone may be diagnosed and there's also been some turnaround time issues with laboratory testing, you can imagine that we'll go back 2 days after they got their symptoms, and so that can explain why the venues are 5 days ago, because if you've gone for a test, you got the test result in 48 hours or 24 hours, then we ask you go back 2 days where you've gone. I think the most important message, can I just emphasise this, is we are dealing with one of the most challenging times that we've ever experienced as a nation. And I would ask everyone to do their bit. This is not the time for going into 5 or 6 shops. And the last thing our contact tracers want is that people have gone to this bakery, to this bread shop, to this butcher, to this thing. I know obviously if we could just minimise the episodes.
Sorry, Dr. Chant, to that. You keep calling it a tight lockdown. Every other state who's done this sort of lockdown doesn't have reject shop open. They don't have Bunnings open. Often they have curfews. Queensland doesn't have Bunnings open. Why? Is it your health advice to have these open, or is it a political decision by Gladys Berejiklian to have these open?
This is one of the most tight lockdowns we've ever had, and can I just say the mobility data is showing that we are getting down to what Victoria did in the stage 4 lockdown. So the data we've got confirms this is a tight lockdown.
How far above the Victoria?
The data suggesting that for most of the indexes, and obviously it varies by some suburbs which are outliers, that we've got to those levels. Now obviously, you know, from a public health perspective, I can't be clearer. You know, please do not go out and about. Please minimise. You know, if you can go shopping every 3 days, that if you're able to do that, please do.
We get that
6 weeks in, Dr. Chan, I mean, this is the list from your website over the past couple of weeks of exposure sites. How can contact tracers possibly keep up?
Well, contact tracers are using technology and the QR code system to get those texts out, and it's pleasing to hear that you've received, or your colleagues have received, those text messages for people to act on. We are scaling that, but obviously with the Delta variant, we realise that some of the environments where we wouldn't normally see transmission, we are occasionally seeing transmission. Now, many of those sites I've got to say, in terms of large supermarkets or large spaces, are not actually driving transmission. As I've indicated before, occasionally we've had a handful of transmission events in supermarkets. But I can't stress enough that every time you're out and about, please do your part by minimising the number of stores that you enter. Please do your part by shopping with purpose. I mean, we've got non-essential retail closed, a very limited list of retail that is open, a very limited list of authorised workers, a very fine list. But we also need to acknowledge the challenges that many critical workers live in southwestern Sydney and Western Sydney. And that mobility that's necessary to provide the care and services our community needs. So we are working on many fronts to look at any opportunity to decrease exposure points or to decrease mobility.
But in terms of contact tracers getting to close contacts in a timely manner, and we've heard that sometimes it's days, sometimes they see it on the website and then call New South Wales Health, even if they've checked in with the QR code, they're not being contacted. Is that the reason why, or part of the reason why there are still so many people infectious in the community, because contact tracers aren't getting to close contacts in time?
The contact tracers have, where we're seeing the most transmission is in the workplaces and households. We're not the only time we're tending to be seeing transmission in shops is when the staff themselves infect each other. So whether that's been introduced by a customer, and then the staff are obviously very close in those shops, and then we get transmission, and in those cases that then amplifies it and we get transmission to others. So
in the workplaces though, where that transmission is happening, is New South Wales Health relying on those workplaces to do that tracing and to contact their staff? Because if it's contained, as you said yesterday, if it's contained in one workplace, you're not necessarily going to publish it on the public website because you know everybody who's in that space. Is the onus then on the company to contact their staff and let them know? And do New South Wales Health take on any responsibility at that point?
yes, we do. So we're still working in partnership. We are working in partnership with the big supermarket chains, because they obviously have very good understanding of who their workers are, and I'd like to do a big call out to the cooperation we're having from those supermarkets. So we are working with them to make sure that they are also taking that action promptly with their staff, because to some extent they can get them to them quicker than we can.
But I guess the question is, sorry, Dr. Chan, the question is about if everything's going smoothly and contact tracers are keeping up, and we're not seeing transmission in shops, as you say, and it's all in workplaces and it's relatively contained, then why are the numbers still where they're at?
So I'm not saying they're not occurring in shops. I'm saying they're occurring when generally there is that there's a number of staff infected at the shops, and then they become a point. I think we've indicated.
Why are the numbers still
So the numbers are going up because we have a number of people infectious in the community. The numbers are going up because we're still having mixing with households. We're still having a small number of people that are not isolating effectively and are not isolating after a positive test. These are some of the drivers for it, and that requires a whole of government approach through the emergency management structures to actually up compliance. This challenge is one of the most great challenges we've got. We've got to work on multiple fronts. If there was a silver bullet for this, it wouldn't be so hard. So basically we need to make sure we sustain those high testing rates. We need to work with the community that they're following those guidance in relation to staying isolated. We need to support them to be isolated. We need to also make sure that there's no disincentives, which is part of the financial support in place, to make sure that people don't think, oh, I've got a cough, but I'm not going to get tested because I don't actually want to know I've got COVID. There are many complex reasons, and this is around working with the community at a very grassroots level to try and stop transmission.
Dr. Chan, because of the nature of Delta, is it possible that this is as close to zero as we're ever going to get? We talk about getting as close to zero as possible. Is 35, 40 cases in the community, is that as close to zero as we're ever going to get?
I think it's too soon to talk about living with COVID. Our vaccine coverage levels are not high enough. And as the Premier has said, we need to get those vaccine coverage levels up at 80 odd % before we can have that discussion. We need to do all we can to drive these numbers down. And we all have a part to play. So rather than looking for loopholes of what you can do in the public health orders, can I just ask everyone in the community and business to really reflect? I'm also asking business to take those decisions. You are required under the public health orders to work from home if it is at all practical. And I think that many of those businesses can do more. I'm really pleased with the partnership with business, but it is a shared responsibility in tackling this very, very difficult situation.
Given the tragedy overnight with the death of the man in his 20s, do you think that young people should give up on waiting for Pfizer? The New South Wales Health website at the moment says they should take up AstraZeneca if they wish to. Should that language be stronger?
Look, all through this outbreak I've deferred to expert advice. And the experts that I draw on is the ATAGI advice. So that's an Australian Technical Advisory Group on Immunisation, which advises the Commonwealth Government. That's a set of experts that have looked at the situation, and at the moment their advice is anyone in the context of this outbreak should be strongly considering if you're 18 and over. I've continually urged all age groups to strongly consider vaccination and talk to your immunisation provider. But we also need to protect the elderly, and I'm really concerned that we still have a number of people in their 90s, 80s, 70s, 60s that are unprotected from COVID, and we need to get them vaccinated.
Sorry, Ashley.
Minister Hazard, may I ask you about the ruling in relation to women who have just had a baby? Given the recent memo...
Sorry, the ruling in relation to
women who have just had a baby post-birth.
I'm not sure what the ruling is, but yeah.
Which was that they can have a support partner with them.
Yeah, what, sorry?
A support partner with them. Yes. Given the recent memo from the Ministry of Health asking all local health districts to allow pregnant women to have a support person with them while in hospital, do you call on chief executives in the LHDs to adopt this advice?
Oh, look, the challenge obviously is, as Dr. Chant has just outlined, and I'm sure you're all aware, we are in a very challenging period. We have a very significant transmissible variant of the COVID virus. So what is happening is that the health ministry is trying to give guidance to work with the various hospitals to make sure that the mums, the dads, the babies are kept safe. And so there's a balancing act here, and I think it depends on the particular area that the hospital is working in. Obviously in southwest Sydney there's some particular challenges. So I have confidence that the advice that the health team are giving to their hospitals is in the best interest of their patients. Having said that, I understand that it's not what we want. I mean, in this day and age, usually partners want to be with the mum, the biological mum giving birth, and it's a challenging time. But I think we've got to give the health authorities in each hospital enough confidence to be able to make decisions that strike the balance between that and also keep other mums and dads and babies safe in those birthing units. Sorry, just go to Liz. Liz, come back to you.
On the vaccine rollout.
Sorry.
Just is the, phase 1, phase A, B, is that all out the window now? Just go and get vaccinated?
No. I mean, I think the federal government set down the priorities by working in the National Cabinet, and there was agreement that obviously health workers, quarantine workers, people at the ports, a whole range of people should be given priority. I think the challenge has been that we don't have enough Pfizer vaccine, but what we do know is we now have much more AstraZeneca, and it has been said many, many times, and Dr. Chancellor said it again, that individuals 18 and over, based on the specialist advice that is given to the federal government, should certainly consider with their medical practitioners or their pharmacist whether or not they should have it. And how many times have we said that the Premier, myself and Dr. Chant have all had the AstraZeneca? It is a vaccine that is available, it's a safe vaccine, Of course, like anything in health, if you're going into an operation, if you listen to the advice that's given, you'll be told there's a risk. The world is not a perfect place, and nor is medicine. But I think we're very lucky to have a vaccine, very lucky to have a number of vaccines. So my strong encouragement to young people, to older people, is to have the vaccine. Go and get it. And sadly, as we just heard, one young person in his 20s has passed away, which I think emphasises what we've been saying now for quite some time, that about 2/3 of all of our cases are currently under 40 years old. It's a very serious issue. Sorry, Ash, I said to Clinton first.
Given there appears to be some apprehension still for some communities in the west and the southwest to come forward either for treatment or vaccination, would there be value in having...
treatment or vaccination?
Treatment or vaccination. Would there be value in having some multicultural leaders actually appearing with you at these press conferences? There was one occasion several months ago, but on a regular basis, multicultural leaders being here.
Look, we've actually been doing a lot of work, which I know the mainstream media thinks that the mainstream media is it. There's a lot of other media that operates in the multicultural community. I had a meeting with, I think it was Dr. Chant last week, and we spoke to the multicultural media on Zoom. Obviously at times the Premier has also had more obvious mainstream media exposure, but in the end the media that operates, and there's many of them who speak in 150 different languages, are reaching out to their community, and we are making sure that we are talking to them. We also have community leaders that we've reached out to regularly, almost daily in many cases, and they are working with their communities and sending the messages. What perhaps isn't well understood is that messages have to be given the right way and heard the right way, and so that's a challenge that we are taking advice from all the multicultural experts, the leaders, and they're telling us how in each different community we can reach out. We're doing a lot of that. And if they advise us again that we would have them with us, we would do that. But also they would have to be speaking in all likelihood in language, and that may or may not be the appropriate forum here for that. Sorry, Alex. Oh, sorry, and then Ash, and then I'm finished. Alex.
Some chronically ill patients, cancer patients getting their treatments cancelled in hospital, chemotherapies cancelled as a result of not being able to have enough resources to do that. Are you hearing that? Is that acceptable? Is it?
I haven't heard that anybody who is... I mean, what I have heard is that the health system is making sure that people's normal health circumstances are well cared for, but obviously there has to be some balancing acts if they're in a particularly challenging area of COVID, because obviously they have to take the appropriate steps, but I haven't heard that there's been anything other than... Sorry, where? I don't know. Look, I heard yesterday from... I hear lots of things from media that aren't always accurate. I heard yesterday there were some problems in the ICU, so I personally rang the hospital management and was told that they had brought in staff from other hospitals to back in because a number of staff had been obviously caught up in a positive case, and there were still 32 beds operational, and everything was going very well. So I haven't heard that, Alex. If I hear it, I'll come back and let you know, and I'll ring you personally. Sorry, Andrew. I said Ashley.
The Victorian Health Minister has said that he has passed on to New South Wales how they do lockdowns. They've got to zero twice. The number here isn't shifting. Was that the Health Minister directly to you? Did you pass that on to the Premier? What do you know that's different about their lockdown, which is effective?
Our lockdowns here are based on our health advice, and that includes the public health team and the broader health team. And they are extremely strong lockdowns. You can't compare one state to another or even one area to another. And I appreciate your epidemiological expertise, but I can assure you that we are taking that. And in fact, when you asked me, do I speak to Martin Foley, I was just literally for a moment distracted from these questions while I was taking a text message from Martin Foley. I talked to Martin Foley probably as I just said, Martin and I talk about all sorts of issues, and I'm sure that I'll listen to him rather than you, but that's not what has been discussed. I assure you that's not what's been discussed. So you can determine whatever you want. Lucy.
On drive-through vaccines, can you tell us a bit more about that? And also in Lake Macquarie, the Pfizer vaccines were diverted from the Belmont hub just a few days ago, but to go to the Year 12 students, but now we're hearing about sewage detection in Belmont. So residents are understandably concerned about that.
Can I assure the residents that what we really need from them is that they go out, as Dr. Chand has asked, and be tested if they have any symptoms whatsoever, or as the Premier said, if they're concerned in any manner, shape or form they might have been exposed to the virus, please go and get tested. Dr. Chand and the public health team, the entire public health team that she consults, need to have the data in order to be able to make informed decisions. So that's the first thing. As to the Pfizer, I think we've talked about that to cows come home, so I'm not going to do that again. And as to the drive-throughs, let me say that New South Wales Health and the team, as stretched as they are, have been opening more and more facilities all across Sydney, and indeed there are drive-throughs and other available facilities in other areas. But if you're referring specifically, and walk-ins as in Prairie Wood and so on, and there are numerous others, which are all up on the website. But if you're talking about what the federal government announced yesterday afternoon, I've seen nothing in writing from the federal government. I'm sure they will tell us. They told the media, obviously, and they will tell us in due course. But I welcome any work that they might be doing in terms of backing in what the state government is doing. Earlier on, they backed us in with some respiratory centres, and I hope that the drive-throughs will be done in a way that is coordinated with our health team so that we have appropriate coverage across the entire Sydney region, particularly in the southwest and west, which is our, if you like, our epicentre at the moment of our concern.
On businesses applying for financial support, they say that they are struggling to get through to Service New South Wales, and when applications are finally approved, payments are not flowing quickly enough. What will the government do to ensure that the rollout of business support can be improved, because the anger is quite high?
Certainly, and we want to make sure we get the dollars out the door as quickly as possible. And for some of you who may have noticed, we've put the newsouthwales.gov.au website up there. We were finding too many people were ringing Service New South Wales, and that was taking a long time. So if people go to the website, they can get immediate assistance and perhaps have their issue addressed online. So we are urging people to go to newsouthwales.gov.au in the first instance. And obviously, if you don't get support through the online settings, then obviously get on the phone. But we want to reduce the wait times for people. We do want to increase the number of applications we're getting through every day. To my best knowledge, tens of thousands of applications have already been undertaken. But that's why we have ensured that people know to go to newsouthwales.gov.au in the first instance. And then if obviously they have further issues or further questions, they can call our Service New South Wales Centre. Well, it depends. For some people, we're finding a quick turnaround. It varies, and I'll be getting an update later today or early tomorrow morning. No, I don't know about those wait times, but certainly the feedback we had in the last few days were that people were waiting a long time on the phones and didn't know that they could go to newsouthwales.gov.au to get perhaps even quicker service. So we're asking everybody in the first instance, if you have a business and you want to get business support, please go through newsouthwales.gov.au in the first instance. But if you don't get obviously your questions answered or you're concerned, then you can ring on the phone. But we were finding that that people were tending to ring up rather than go to the online service that's available.
Why isn't the lockdown working, Premier?
If the measures in the lockdown are enough, and if contact tracers are on top of the situation, how do you explain why the numbers, or why do you think the numbers aren't?
Well, look, it's obviously best answered by the health experts, but clearly what we've seen is unfortunately it just takes a small number of people not to get tested before they need to, not to stay home before they need to see various spreading issues occur. We still don't know the impact of some potential super spreading events that occurred a week ago or a week or so ago. So it's a number of factors, and that's why we're urging everybody, if you have the mildest of symptoms, don't go to work. Don't leave the house unless it's to get tested, and please stay home and isolate. And that is really important. And we know from the Delta strain overseas that jurisdictions the size of New South Wales that started off with the same number of cases we did are now having daily rates in their thousands. Now, I'm not suggesting we are in a position we want to be, but please know that if we hadn't taken the measures we had, that our case numbers would have been in their thousands. Now, I'm not going to rule out case numbers won't get worse. I actually think they will get worse. If you look at the number of people infectious in the community, it indicates that perhaps we haven't reached our peak. But the other issue I want to say is that in relation to mobility, we we did release some data a few days ago demonstrating that in many local government areas, mobility is down, further down than what it was in Melbourne during their worst lockdown. So I just want to stress that the vast majority of people are doing the right thing, but because of how contagious this is. So it's really difficult to make comparisons because the Delta strain is so contagious. Different cities have different pockets of concentration and challenge, and that's why it's really important to to give time for our settings to take effect. Now we know that had we not put those settings in place, the case numbers today in New South Wales would undoubtedly have been in their thousands. But that's why.
Melbourne was actually able to reduce their mobility more in 1 week than New South Wales was able to do in a month, in these two equivalent lockdowns happening at the same time. More in a week than we've been able to do in a month. So that's not really a positive reflection of the mobility.
Well, look, I don't know those figures you refer to, but remember Melbourne got up to 700-800 cases a day without the Delta strain. So the fact that we've kept it at bay should give people comfort. So the fact that we're only at a couple of hundred a day, which is serious in itself, demonstrates how much work we've taken to keep the virus at bay. The challenge for us is we need to do better than keep the virus at bay. We need to get those numbers down, and the lower the numbers get, and the higher our vaccination rate by the end of August gives us options as to what life looks like on the 29th of August. And that's why we're asking everybody to please respect the health orders that are in place, not assume that this virus strain, because many communities, all of us who've lived through lockdown, can't assume this is the same as other types of COVID that we've seen. The Delta strain is very, very different. The Delta strain moves in different ways. We've tried to explain every day the types of settings where it continually is more contagious than other settings. So we ask everybody to please stick to the settings that are in place. They're there for a reason. And you need to also look at the various challenges we have in certain communities as well. But please know, had we not taken the action we had, today's numbers would be in the thousands. I know it's little consolation. We still don't have the numbers where we'd like them to be. But we also ask communities to keep working with us, to keep doing the right thing. And I do want to say a special thank you to community organisations in those 8 local government areas. I know this press conference is translated every day into a number of languages. I know the micro strategies that are going on to target specific communities and support those communities get through a very difficult time. And we also need to remember that, health. We find in different parts of the state, households and the number of people in a household makes a difference. And in some parts of our communities, there are households with double digits, households of 10, or others aren't uncommon in parts of Greater Sydney. So these are all challenges we need to work through. But it's only with working together, bringing the community with us, going on the journey together, that can happen. And we are all in this together. Every single person in this state is doing it tough at the moment to varying degrees. Everybody has put life on hold. I mean, there isn't a single person I know that hasn't put life on hold, and especially, my thoughts go to parents who are trying to teach their children or support online learning as well as working themselves, as well as getting food on the table, notwithstanding every other category of person who's doing it tough. We get all of that, but it's only through working together that we can get through the next few weeks. I want to see, obviously, things improve by the end of August. I want to see vaccination rates go up. I've set that target of 6 million jabs by the end of August. I think we can get there so long as we ask everybody to come forward. And also, I have to say, as a state, we always make use of what we have. We make the best of what we have in terms of the vaccinations, in terms of where we can have access to them. Please know that had the New South Wales government not stepped up, provided all those mass hubs when at the time we were told we don't need them, we are now in a position to have capacity to get jabs in arms, so long as obviously we get those vaccine doses arriving in the next few weeks. And that's what we're looking forward to.
Yeah, if we haven't reached the peak yet, do you have the modelling that shows when we will reach the peak and then therefore when we will reach zero?
The challenge is the modelling will have a number of variables. So it depends on, a number of things depend on what the future looks like. There was some modelling I saw the other day which predicted that on today we would have more than 500 cases based on where we were a few weeks ago. So whilst... Oh, look, that is only, can I just say, I'm not a medical expert, that is my humble guess, given every day we follow the number of people infectious in the community and the way in which the virus moves through communities. I hope we have, but my instinct, and I'm not a medical expert, I'm only telling you what I view given the numbers that I see every day and the way that we follow the way the virus goes. It's difficult to know whether or not we have reached the peak. We will turn the corner. It's a question of when. The settings will allow us to turn the corner. It's a question of when. But I know that life will look differently on August 29 if we get those vaccination rates up and if we get the case numbers down. And that's what we are looking forward to.
Oh. Issue there. If you don't mind. Zero tolerance for people doing the wrong thing, but we're hearing examples of people who say they weren't doing the wrong thing and they're still copping fines. A gentleman we spoke to was flying a kite and he got a fine. I mean, are we going a bit too far in some instances? Are police going a little too far?
Look, I don't know specifically about the gentleman flying the kite. I think what's interesting is that there are millions of people every single day doing the right thing. Yesterday, 360 penalty infringement notices issued. Those 360 people need to have a good hard look at themselves and make sure that when they walk out the door, my view is you turn around and have a look who is inside your home and what you are going to bring back to those people. So the police are taking a very firm approach. There's absolutely no question about that, but we are also very fair in terms of when we issue a penalty infringement notice, we listen to the person, and if they have a reasonable excuse, if they can mount a reasonable argument, they're not the people getting penalty infringement notices. It's the people who clearly step outside, who make a conscious decision to not be one of those millions of people who are doing the right thing that can get us out of this situation as quickly as we can.
Thank you.